You're listening to the Life with Old Dogs podcast, and I'm your host, Dawn Mimnaugh, primary caretaker of all of our wonderful senior German Shepherds right here at Woody's Place Senior German Shepherd Sanctuary. Hey there, folks, and welcome back to Season 3 of the Life with Old Dogs podcast. Again, we are covering the top 20 most common health issues found in older German Shepherds. And this week we are covering number 9, which is dental issues. All right, so dental issues can be a real problem for senior German Shepherds. It can be a real problem for any dog. And again, I've said this before in other podcasts. Of course, these health issues pertain to lots of other dogs in general, particularly older dogs. But we are covering older German Shepherds because that's what we do here at Woody's Place. Older German Shepherds, senior German Shepherds. So, all right, dental issues, senior German Shepherds. And the effects of poor oral care, can be felt throughout the entire body, all right? So it's just like us, folks. You know, you have bad teeth, you have bad gums. It affects your overall health. It doesn't just stay in your mouth. It's primarily in your mouth, but the effects can be felt throughout the entire body. And it's the same thing for our dogs, only they can, open their mouths and verbalize the fact that they have bad teeth or poor gums and maybe, an infection in their mouth and it's hurting them and it's making them feel sick. So it can be felt throughout the whole body. So as our German Shepherds age, again, just like us, their teeth start to wear down and decay, and the gums may not be as healthy as they once were, which can lead to pain, infection, loss of teeth, and again, other health problems, which can even be life-threatening. I mean, it is no joke. Prevention, of course, is key. But sometimes you can do everything right and your older German Shepherd can still suffer from dental issues. Okay, so if you have an older German Shepherd, it's important for you to be on the lookout for dental issues and take the necessary steps to correct the dental issues as soon as possible so that, you don't make a mountain out of a molehill. All right, so if you see, a cracked tooth, a tooth that was chipped, you want to get it checked out as soon as possible so it doesn't lead to something else. And of course, prevention is key. I think I said that before, but I'm just reiterating that. So let me break down the most common dental issues in senior German Shepherds. I say senior German Shepherds and older German Shepherds. It's interchangeable. I'm talking about German Shepherds 8 years and older. Plaque. Plaque it's caused by food and bacteria, and it builds up on your older German Shepherd's teeth over time if they're not brushed regularly. All right? It's common sense. It is, again, the same as people. You get plaque on your teeth throughout the day from the foods you eat, the coffee you drink, the sodas you drink, whatever. And the plaque, it's like this filmy substance that builds up on your teeth. And if you don't brush your teeth like for a day, you can really feel it. It feels kind of like you're wearing a sweater on your teeth. So that's plaque, all right? It's a bacteria that builds up on your teeth over time, and it's the same for your senior German Shepherd. All right, next is tartar. Okay, so this is progressive. You get plaque in your mouth, in your dog's mouth, And if you don't brush your dog's teeth or help them clean their teeth in some way, shape, or form, then tartar starts to build up. And tartar is what happens when plaque is not removed from your older German Shepherd's teeth regularly. Okay? You may have seen it on their teeth and didn't even know what it is, but it's this funky, kind of tannish brown, hard substance that you'll see at the base of their teeth and on their gums. And plaque, so tartar is plaque that it mixes with your dog's saliva, and then it forms this hard deposit on your dog's teeth. And like I said, and their gums, and then it needs to be scraped or chipped off with a special dental tool, and they call that scaling, I believe. So basically, tartar is all the food particles and bacteria, plaque, that are not removed from the teeth and then solidify, creating an encasing of toxins and downright stink that your older German Shepherd then endures every single day for the rest of his life until it's removed. And it's I'm sure not a good feeling. I've never had tartar, so I don't know, but I am certain it's not a good feeling. I've seen it on dogs' teeth that have come in through Woody's place. I've actually sat in on dentals because I have really cool vets that I've actually witnessed them scaling the dog's teeth and literally scraping and chipping the plaque off. It just looks terrible. It looks like cement on their teeth. And I can't imagine how, unfortunate dogs, whether they be German Shepherds or not, go throughout their lives with people who are supposed to be caring for them and don't recognize the importance of their dental health. And these poor dogs are stuck with that nasty stuff on their teeth. It's got to feel awful. And also can make them sick. All right, moving on. Gingivitis, again, happens in people as well. It is an irritation and inflammation of the gums caused by plaque and bacteria and toxins that get underneath the gums, all right? The gums then become so infected with gingivitis that they may become painful and even bleed. So I don't know if, you've ever had experience with that or known someone who has had experience with that. I have known a couple of people with gingivitis and know that even to brush their teeth was painful for them, and they'd end up with blood. I'm sorry for being so descriptive, on their toothbrush because they couldn't even brush their teeth without it affecting their gums in a painful way because of the gingivitis. It's the same for dogs. And again, they can't open their mouth and verbalize to us how they're feeling, but it's equally as painful for them as it is for humans. And gingivitis is an early stage of periodontal disease. Okay, moving on. Root abscess. Ugh, there's a word right there that just makes me cringe. Abscess, tooth abscess, yikes. I'm petrified of the dentist, people, petrified. But I make the dogs get their teeth done. All right, root abscess is caused by bacteria entering an exposed root canal on the tooth. So I'm sure you can see how that happens. Okay, you have your older German Shepherd, and perhaps, they have tooth decay, teeth are worn down, they're ground down, and a root canal may be exposed, or perhaps they might have chipped a tooth or broke a tooth that was never really addressed, and then all of a sudden, here we have the root canal that's been exposed, and all this debris, food debris and plaque and bacteria and toxins is getting in there, and that's just that's a recipe for root abscess. Okay, and the last common dental issue for older German Shepherds is periodontal disease. Now, I just mentioned that gingivitis is an early periodontal disease, but periodontal disease has a few stages. And again, it's the most common dental disease in dogs, with an estimated 90% of dogs having some degree of periodontal disease before they are 5 years of age. Periodontal disease is caused by bacteria buildup that slowly destroys your older German Shepherd's teeth, gums, and even the bones supporting the mouth, such as the jaw. So you're seeing a theme here, reoccurring theme here: bacteria, bacteria, bacteria in the mouth leads to so many problems in our older German Shepherds. So it is imperative to clean your dog's teeth to get that nasty bacteria out of there. All right. Anyway, back to periodontal disease. Periodontal disease can be painful and cause a host of problems, which can become life-threatening. So let's break that down a little bit. There are 4 stages to periodontal disease, and I already talked about the first one. That's gingivitis. Okay, and we talked about gingivitis already, but just to recap, it is an irritation and inflammation of the gums caused by plaque, bacteria, and toxins that get underneath the gums and cause the gums to become painful and bleed. All right, again, no fun. Second, moving on, is when about 25% of the teeth and bones are gone. 3, that's when 25 to 50% of teeth and bones are gone. And then the last stage is when more than half of all teeth are loose and missing. So that's pretty sad. But stage 1 of gingivitis is the only stage of periodontal disease that is reversible. And stage 2 and 3, it can't be reversed, but it can be maintained so that it doesn't progress to the final stage, which is loss of teeth. Like the teeth are just gone. That's it. There's no the gums can't even really support holding the tooth in anymore, and it just comes out, rots right out. All right, so moving on here, what are the signs of dental issues in senior German Shepherds? There is a lot. There's a whole lot, and again, it's the same as in people and other dogs. So here we go. Bad breath, that is first and foremost. And boy, I have a little story here. So we've had dental issues quite a bit with the senior German Shepherds that have come to us over the last decade plus. There are a few that stand out in my mind. One is Molly. She was the first German Shepherd, official German Shepherd that came to us. There were a few that came before our paperwork was finalized, but she was the first official, and she was about 12 years old. I don't know how many teeth she had to have, like 8 to 10. They were just so bad. You could smell her before she even entered the room. Her breath was so bad. Smokey, he was another one who had some teeth removed, not that many, I think maybe like 2 or 3, and he had bad breath. Misty was another. She was one of our super seniors who came in at 14 years old, and this poor thing, she had several teeth removed. I want to say about 5 or 6, and she had horrible breath. But the worst, the one that takes the cake, was Sarge. So Sarge was with us a few years back. He was 12 years old when he came to us, and Karen, or one of our volunteers, and myself drove down to central Pennsylvania to meet Sarge's owner with Sarge for him to surrender Sarge to us. And we loved Sarge. We loved him so much. He was such a happy-go-lucky, goofy boy. Who didn't like Atticus because Sarge liked Brandy. And of course, we all know Brandy and Atticus are a thing, but that's beside the point. Sarge was not in the truck a few minutes before Karen and I realized his breath was so hideous, we had to roll down the window. Now, I know that sounds like an exaggeration, but it was a 3-hour trip north back to the sanctuary with Sarge. And when I tell you, we had the windows in the truck rolled down, all 4 of them, with the slide window in the back open. And Karen and I practically had our heads out the window like a dog riding in the car because we had the worst headaches. Okay, that is not an exaggeration. We had the worst headaches from Sarge's breath. It was literally making us sick, being in a contained vehicle with this poor dog and his horrible breath and his rotten teeth. So we had Sarge to the dentist almost immediately. The veterinarian, I don't mean dentist, the veterinarian immediately, having blood work done, a full physical, making sure he was well enough to undergo anesthesia, and got those teeth pulled right out. Not all of them. We were able to save some, but he had to have like a soft diet pretty much because he ended up missing so many teeth. But that his breath would have knocked your socks off. It was just that bad. And again, if it made Karen and I sick, smelling that dog's breath for 3 hours, can you imagine how that dog felt physically, having to actually breathe it himself and have it in his body, ingesting it, not able to get away from it? I mean, he must have felt awful. Must have felt awful. And I'm sure he didn't like having teeth removed, but once the smoke cleared from having the surgery of having the teeth removed, he went on to be a very happy boy. All right, moving on. Drooling. That's another thing you may notice, and Sarge did that a lot. He drooled. Especially on the side of the mouth where the teeth are bad or the gums are inflamed. Now, it could be the whole mouth, but it might be one side or another. And also the same goes for like a broken tooth. Reluctancy to eat. That makes sense. I mean, if they've got a mouthful of bad teeth or teeth that hurt and gums that hurt, they don't want to eat, which leads to can't chew when eating. Some dogs will literally just swallow their food. They won't chew because they can't chew. It hurts. So they just swallow. Reluctant to play with toys. Same deal. They can't hold a toy in their teeth because it hurts. And of course, if they can't eat properly, it's going to lead to weight loss. Another thing you may see is your older German Shepherd rubbing his mouth with his paw or against an object such as your leg. Older dogs will do that. Dogs will do that in general. If their mouth hurts, if their ear hurts, if something's bothering their nose, their little snickle snooter, they'll rub it against your leg if you're standing next to them because it's providing them with relief. Tooth discoloration, tartar, which you can visibly see. Gums that are red, irritated, swollen, and perhaps even bleeding. Again, you can see this. Missing teeth. Once again, you can see the fact that they're missing teeth. So now we're talking about symptoms outside the mouth. And when I say that dental issues go beyond the mouth, here's what we're going to start talking about. Discharge from nose and possibly eye. Okay, we have seen that twice with dogs that their mouths have been so bad that they literally have, it looks like mucus coming out of a nose of a baby who has a cold and can't blow their nose. It's like that. And it's coming out their eye and possibly their nose as well. Facial swelling. Again, this typically applies to if there is an infection on one side of the face or possibly swelling on both sides of the face, but the face will start to swell. And I'm going to take this a step further, and I didn't put this down here as one of the symptoms, but we have literally seen, okay, this was Gracie, and she was only here for a week before she bloated and died. That dog's face literally blew apart. Okay, right on her cheek, literally blew open. We thought she was cut with a knife or something when she got here. The infection was so bad. We thought she had been mutilated in some way. Her face blew open because her sinus capacities could not take the pressure from the infection from her teeth being so bad anymore that her face literally abscessed and blew open and all the infection came out. It was terrible. It smelled awful. And that poor dog was in so much pain that she actually bloated from it. She actually bloated from it and died before we were able to get her the surgery to correct her teeth. Excuse me. Facial swelling again. Okay, we talked about that. Being snappish and aggressive. All right, this is really common sense, and it really irritates me when I see it. Okay. They become snappish and aggravated because they hurt and they don't feel well and they have no words to tell you. This is how they're feeling. So they react in a way that some people might deem inappropriate, but really it's a cry for help. Okay? If you've ever had a toothache, needed a root canal, had issues with your gums, had gingivitis or whatever, it is not a cakewalk. It hurts. And you can do something about it, but these older German Shepherds can't. And I'm sorry, I'm saying, again, too much. Sorry. So they become snappish and aggravated. And when people write to me and say, well, my older dog's become mean, he's biting or he's snapping, my first response is, have you had him to the vet to get him checked out? Because most likely it's a medical issue and he's not feeling good. And this is his way of conveying that message. I'm not feeling well. I need help. So they become snappish and aggravated when they have ongoing dental issues that have not been addressed. The last sign that your dog has dental issues is they can be visibly ill. I think I made that quite clear telling you Gracie's story. She was visibly ill. Same with same with Sarge, same with Misty, same with Molly. They were all thin, underweight. They looked like they didn't feel well. They conveyed that message loud and clear that they weren't feeling well. They didn't want to eat. They were losing weight. Again, just not feeling well. All right. So the signs will present themselves if your older German Shepherd has dental issues, but it is up to you to be able to pick up on those signs and get your dog the help that he needs if he has problems with his teeth and his gums. So, all right, you picked up on the signs. Your dog has issues with his gums and or his teeth. Now it's up to you to take your dog to your trusted veterinarian to have the issues addressed. And so when you get there, what's your trusted veterinarian going to do? She's going to diagnose the problem, and she's going to perform a dental exam, which means that she's literally going to lift your dog's lips and look inside your dog's mouth to determine where the problem is and what the problem is. Sometimes this is easier said than done. Now, we've had dogs here at the sanctuary, no problem. I mean, you can lift their lip up over their head. They don't care. Just go ahead, check it out, do what you got to do. I really don't care. Other dogs, no, not so much. It's ridiculous. They're upset. They don't know what's going on. They're in pain. Not happening. And you can't muzzle them. You can't muzzle them because, they have to have their mouth open to have their examination. So at this point, if this is your older German Shepherd, as long as they're healthy enough and your vet determines they're healthy enough, will have to undergo anesthesia or some sort of sedation to have that visual inspection done of their teeth and gums. Now, at that point, and this is what our vet does, at that point, since they're already under anesthesia, our vet will go right ahead and perform whatever needs to be done to correct their dental issues. It's cleaning teeth, scaling teeth, taking care of their gums, performing an x-ray or two if that needs to be done, checking for any sort of bone loss if there's any issues with the jaw. She's going to do all of that while our senior German Shepherd resident is put under anesthesia, so we can just call it a day and be done, and then don't have to, deal with that anymore. And of course, this is usually, and there I said, again, I'm going to wear a rubber band around my wrist and snap it every time I say that. But anyway, we typically have to go back and make an appointment for that special procedure to be put under anesthesia because, there's, snap the rubber band. By the time we get up there, the dog may have eaten already, may have, drank water already, whatever the case may be. So we typically make another appointment and go back up for the sole purpose of having the dog put under anesthesia or sedation to have a dental inspection and dental work done at the same time. So just a little tip there for you. All right. What happens if dental issues are ignored? What happens is you can end up like Sarge. Your dog, I'm sorry, not you personally, but your older German Shepherd could end up just like Sarge, knocking your socks off with his bad breath and him feeling horrible. Or like Gracie, that she actually ended up dying because she couldn't take the pain anymore from her ongoing dental issues. So our fur friends are no different than us in that if we have bad teeth or infected gums, I've said this before, I'm saying it again, it hurts. And if we let it go, it manifests into bigger problems that can make us unwell and make our lives miserable. So the problems can range from a simple toothache, which isn't simple, it's horrible, to jaw pain and facial pain and deterioration, to tooth abscess, to sinus infections. Yes, it is connected, to eye issues, to abscess of the face, which I described in Gracie, to here's the life-threatening thing, folks, even to cancer and organ damage to the kidneys and the liver and the heart. Okay, life-threatening. So it is the same with people. All right, if you let these things go, it affects your vital organs, and it's no joke. All right, so if you suspect any sort of dental issues, which you should be doing, you should be checking your dog's mouth periodically. Maybe once a month, maybe once every other month. I wouldn't go any further than that. Open their mouth. Look at their mouth. Actually, you should be brushing your dog's teeth daily. So you should be looking at their mouth regularly, but really get in there good and check things out if you can. You don't want to get bit, but if you can, I wouldn't go any longer than 2 weeks or 2 months. Really check their mouths for any chipped teeth or anything like that. But you should be brushing your dog's teeth daily, and we're going to cover that here in a second on how to prevent dental issues. Okay, so the object here is to maintain good dental health so that your older German Shepherd is living his best possible life. And how do you do that? All right. Well, I have some steps here to prevent dental issues in senior German Shepherds. It's the first is brushing your dog's teeth. So I know some people are like, "What the heck are you talking about?" I have trouble remembering to brush my own teeth. I have so much to do in one day, and now I'm supposed to brush my dog's teeth too. Yes. And maybe make it a routine. After you brush your teeth, brush your dog's teeth. So you want to brush your dog's teeth daily, okay, with a soft bristle brush or even a silicone finger brush. They sell them on Amazon. I have it in our blog post. As a matter of fact, there's an Amazon link down at the bottom. You can see it is so Woody's Place has, I don't want to say it's like a storefront, but it kind of looks that way. It's a preferred product list on Amazon. It is items we use, not only use, but prefer here at the sanctuary for our residents. And trust me when I tell you, I have a closet full of stuff that has either been sent to us, donated to us. Here, try this. This is a great product. Try this. And not true. And it ends up going into a closet until I get enough stuff together that I could take it and donate it to our local shelter. So I feel like we're pretty versed in what works and what doesn't work in terms of products. So we have this Amazon preferred product page, and I have the link to it in the blog post this week for dental issues, and I will be sure to post the link for the blog post in the show notes of the podcast. So look for it. And you can just click on there and check out what we're using. The toothbrushes that we use, the silicone fingers that we use. I like the silicone finger brushes. Let me just clarify. I like the silicone finger toothbrushes for our seniors here that I know aren't going to bite my finger. We have some. Prince doesn't like it. Savvy's a little skeptical. So for them, I use a regular soft bristle brush so that if they're going to bite anything, it's going to be the brush and it's not going to be my finger. I already had that happen. Can't afford to lose any more fingers. Okay. Also, there is specified toothpaste for dogs. You don't want to just go using any toothpaste, all right? You don't want to use your Colgate, Colgate whatever to whiten their teeth or whatever. No. You're not using human grade toothpaste on your older German Shepherd. It is canine specified toothpaste. And again, we have that listed as well. I like Arm & Hammer products. I'm a huge proponent of baking soda. In fact, in the blog post this week, I have a very simple recipe in the bonus section for homemade dog toothpaste that is effective. There's only 3 ingredients, and you probably already have them in your kitchen. It's super easy to make, and it's all natural, and it does a great job. So make sure you check out the blog post. But anyway, all right. Kibble. Now, I know. What are you talking about? You cook for the dogs of Woody's Place. I do, but we also use kibble here. Talked about this before. I try to do a 70-30 split or an 80-20 split. I'm not Wonder Woman. Sometimes I don't have time to cook for them, and they get kibble. So we use a high quality kibble. Of course, we love Fromm. We are, again, huge fans of Fromm dog food. That's FROMM. It's a small family-owned business in Wisconsin, and absolutely love Fromm dog food. So a high-quality kibble is a natural way to scrape, for the dogs to scrape their own teeth to get rid of the tartar buildup if there is any tartar on their teeth. But some people use dog treats. I know people are huge on milk bones. That they say just that. They have a giant box of milk bones on top of their fridge, and you just can't see it. But I'm inserting an eye roll right here. Don't give your dog milk bones. It's nothing but junk. But anyway. Getting off that soapbox now. Something along those lines that's hard and crunchy scrapes the tartar off your dog's teeth as they're chewing. All right. So it's a good thing to do, but you have to make sure whatever you're giving them is good for them and healthy. Please don't give them junk like milk bones. And folks, I'm sorry. If you give your dogs junk, milk bones, you're just, it's junk. There's nothing good in those milk bones. I hope I don't get sued over saying that, but moving on. Give your older German Shepherd, again, something to chew on. There are specified specific products out there that are approved by the Veterinarian Oral Health Council. All right, that's the VOHC. Because not all chew toys are suitable for your older dog, like tennis balls. They're not really great for your dog to chew on. That fabric on the outside of the ball actually can mess your your older German Shepherd's teeth, can mess them up. So there are specified chew toys that again are creating that chewing motion and stripping any sort of plaque, tartar, whatever buildup off your dog's teeth as they're actually chewing on the toy and enjoying it. And you definitely, like I said, want to look for the label from the Veterinary Oral Health Council, VOHC. You can Google it. You can Google it and look for toys that would be great if your dog is toy motivated, that would be great for your dog for their oral health, for their teeth. And lastly, but certainly not least, regular checkups. That is your best defense in maintaining your dog's healthy teeth and gums as they age. All right. So when dogs are younger, they should have an annual exam. Okay, they're just going to get a physical, maybe blood work, just a good once over, making sure that they're okay. If they need, their rabies vaccine, that's when they're getting it, and it's all good. But as our German Shepherds age, okay, so from 8 on, they should definitely be going once a year. And not only should they just be getting a once-over, they should be getting a full blood panel done and chem panel while they're there so that you know how their body is performing and if there's anything going on that you can't see that you can address early instead of waiting for something bad to happen. So while you're at this exam, if your vet doesn't do it, insist that they look in your dog's mouth and check for their oral health, because sometimes it gets overlooked. And as they become geriatric, when they reach about 10 years old, you should be taking them every 6 months to the vet. I'm not saying that they have to have blood work done every 6 months, but they at least should be seen at the vet every 6 months to make sure that everything's still running, functioning smoothly, and again, get their teeth checked during this annual or semi-annual or biannual exam. Okay. In addition to checkups, professional regular cleanings would be super beneficial for your older German Shepherd. Who doesn't like getting their teeth cleaned? I mean, okay, no one likes to get cavities filled or anything like that. No one's like, I'm going to the vet. I'm going to the dentist to get cavities filled. No one does that, but I'm pretty darn happy when I go get my teeth cleaned. I feel great. I feel like $1,000,000. So does your older German Shepherd. It's a good feeling to have a clean mouth. So I would highly recommend making sure that your older German Shepherd has regular teeth cleanings. Now, just a little side note here. There are other products as well to maintain decent oral health in our older German Shepherds. There's products that you can add to your dog's water that supposedly help keep your dog's mouth clean and plaque from building up and whatnot. There's all natural ways of doing that too. Again, you can mix like a little baking soda paste on your finger, perhaps put a little mint in there, kind of swish it around in your dog's mouth if they like it. that might work too. And again, toys, specified toys and crunchy treats. Okay, so be sure to check out our preferred product page on Amazon. Check out the link in the blog post. I'm repeating myself, but there's some good stuff there. And again, it's pretty much Arm & Hammer because I trust their products, and I'm I'm just a huge proponent of baking soda based anything. All right, so that's pretty much it for this week. I hope this blog post helps you understand the importance of dental issues and oral care in your senior German Shepherd. And again, highlighting the main points. Regular brushing is important for maintaining good dental health. That being said, it's really, really important to start your dog at a young age, brushing their teeth if possible. So I understand, we're not able to do that. Everybody comes here to us is already old. So, some of them like it, some of them don't. But if you're getting a younger dog, a puppy, start brushing their teeth right away. Get them used to it so they're not traumatized by it. If you have an older dog or a newly rescued dog, start slowly. Feel them out. Start touching their face. Maybe lift their lip a little. See what they do. Be very, very careful. You don't want to get bit. You don't want to just go opening their mouth and sticking your fingers in there, or jamming a toothbrush in there. That's not gonna fly. You really want to be delicate about it and go slow and build them up till they get to the point where, okay, I'm getting my teeth brushed. I know what this is now. There's no need to panic, and I'm going to be okay. All right. So by doing this, of course, your dog's overall health is going to be in tip-top shape, and their best shot at being in tip-top shape. You're not going to have to worry about them not feeling well because of some underlying dental issue. And bonus, you won't be shelling out a ton of money in the long run because your dog needs to have a bunch of teeth moved because, their teeth rotted out of their head. So that's always a good thing. Okay. It's like maintaining a car, folks. It really is. If you get the oil changes regularly, get the tires rotated regularly, do the maintenance regularly, you're most likely not going to be socked with this, blindsided with this astronomical bill because you didn't know that, you didn't know something was going on under the hood until you're in trouble. All right. So that's all I have for this week. I'm sorry. I don't know. I probably said, about 30 times. I don't know why I say that so much, but again, I'm working on it, folks. All right. So, in the show notes, I'll be sure to post the link for the blog post that goes with this podcast. And, also just want to let you know that, in the season 3 of the Life with Old Dogs podcast and blog post, again, we're covering the 20 most common health issues in senior German Shepherds. So you want to go to our Facebook page. That's WPSGSS.org. And you want to subscribe to our website. There's just scroll about halfway down the main page there, and you'll see a little postcard and it says join our mailing list. You want to subscribe to that because at the end of season 3, anyone who's a subscriber is going to get a free PDF ebook covering this whole darn season of the most common health issues of senior German Shepherds. And you can keep it on your computer or your Kindle or your cell phone or whatever you want to do and pull it up as a reference as needed. You can print it out. You can share it, whatever you want to do. It doesn't matter. It's yours and it'll be yours to keep for your own reference. This way, if you have there's that's a bonus, right there, because I'm almost done. But yes, as our fur friends get older, it's important to have stuff like that on hand. And sometimes it's just such a to-do, surfing the internet for, there's another bonus, for all this information that might not even pertain to your your specific situation with your older German Shepherd. All right. So be sure to subscribe. And at the end of season 3, you're going to get a whole PDF ebook to print out or just keep on your computer of the 20 most common health issues of senior German Shepherds. Okay, that is it for this week. Next week, we're up to number 10. That's the halfway mark, and we are covering diabetes in German Shepherds and senior German Shepherds. All right, folks, until then, be well.